Good morning, bonjour. Je partage immédiatement mon écran. Um, so my presentation will be in English and slides are in French. I hope this will facilitate. So the presentation on regulation of cannabis and this idea of punitive decriminalisation, it's a work I've been doing with my colleagues, Véronique Fortin from Sherbrooke and Marie-Ève Sylvestre. Véronique is with us today, but she's joining us only for the questions because it's going to be quite awkward to do this during the presentation due to time limits. My presentation is organized in roughly 5 parts. A contextualization, a second block on Ceci n'est pas la criminalisation, which is paraphrasing Magritte, famous piece. Then I will move to this idea of opening a Pandora box of the legal cannabis framework, transitioning to the idea of a certain normative inflation that occur and the process of legalization of cannabis, and this idea of syzygies, which was pretty much a new word coming from astronomy that I learned in the last couple of weeks of these plurinormative and multijuridictionnel arrangements to make things happen in one way or the other, leading to a conclusion. So moving fairly fast. So the contextualization, usually we start our presentations in the past talking about the act itself. And well, I think for today, we should go back a little bit further because when dealing with harm reduction, this started a little bit before. So in 2005, government Canada engaged to legalize cannabis in the country and mandated like 3 ministers to deal with the issue: health, justice, and public safety. So about 6 months later, in mid-2016, they created a task force on the legalization and regulation of cannabis. The task force was very diversified in terms of composition. Scholars, and some of them openly harm reduction folks, people from the world of politics, either federal level, municipal, provincial level, health professionals, and police officers. So it was quite interesting that the final report released in December of that year, so the framework for the legalization and regulation of cannabis in Canada was pretty much harm reduction oriented, and probably one of the few official publications of the government with a wording in that sense. This was the base for the regulation of cannabis within the Cannabis Act, and even a little bit later on the regulation somehow. But what is interesting is that, well, this doesn't appear that much in the law. You know, the law, the Cannabis Act is the central, in a way, and I should put in quotes that because it's not only the most determinant piece of legislation of a quite large legal framework that operates way beyond the federal jurisdiction. So what I'm going to try to discuss in terms of argument, you know, it's pretty much unfolding this in 4 parts. Well, this idea of harm reduction is really present in the report, you know, the proposed framework, but not necessarily in the law. So the Cannabis Act, this was not necessarily there. Then we'll go into a discussion a little bit on the act itself. Well, decriminalization was maximum partial, and I think some of folks already mentioned this early this morning. And actually, I'm going to argue in a way that's quite similar to what Alana Klein's claiming in recent publications. And this transfer to other jurisdictions and other normative regimes in the legal cannabis regimes, they tend to come with punitive effects, which is somehow troubling, and even more troubling than we think. And finally, I will pretty much conclude that, well, there is a little bit of everything in the legal cannabis framework from the social control side of it, uh, including harm reduction, which is, we should sometimes see the bright side of it as well. Ceci n'est pas la criminalisation. This is not about the criminalization. So the Cannabis Act did two quite interesting things. When you see that way, you cannot unsee. You know, it did not decriminalize cannabis. Illegal cannabis, so the status quo of cannabis as legal substances, is still exists. Illegal cannabis is still a criminal matter in Canada. And actually, it's worse. So it's not only not having harm reduction in place, but on the contrary, it's more punitive. We're going to see quite quickly on that, not a lot of details. But at the same time, the Cannabis Act did create the category of legal cannabis, also for recreational purpose, which is legal cannabis itself was not totally new because it exists for medical purpose, but well, it did create for recreational purpose. So it's not about decriminalizing cannabis, it was about keeping criminalized what was already criminalized with more punishment and more crime actually, uh, and at the same time creating a legal framework for the legal cannabis. Okay, well, but this legal framework came with some kicks. You know, it came with a transfer to other jurisdictions on the regulation, on the production, distribution, selling, possession, and consumption. You know, you need to figure out where you can consume uh, legal cannabis. So it's a sort of opening a Pandora's box. So quite quickly looking on how it was still illegal and more punitive. I'm not going to go into all the details into that. There's two important things to point. This mark of a maximum amount of punishment of 14 years as it implies an impossibility to serving a penalty in the community and also leads to deportation, which is also problematic because it came with new infractions dealing with minors. And I think we're still to see the effect of that in visible minorities and people in conditions of vulnerability that were already overrepresented in the criminal justice systems related to drug offense. So opening this idea of Pandora box, like we have more or less like the status quo framework before the legalization or the decriminalization, and like the decriminalization actually opened a vast amount of normative regimes operating both on federal level, provincial levels, and municipal levels, and also actually non-state-based normativities. You know, we do enter in some legal pluralism zone that may produce some punitive effects, and they may reduce possibilities of harm reduction. For instance, uh, rules regarding condominiums or universities. We're not talking about state-based normativity and so on. So it's not about only multiplying these regimes, like this transfer to other regimes comes with a little bit of tricky effects, especially considering our past research on immigration, homelessness, protesters, and so on, because we're not operating necessarily in a kind of a traditional criminalization model with a progressive funnel, with policing, uh, accusation, and the judiciary going on. What happens in these regimes is a certain reinforcement of the policing side. You have a certain contraction of the judicial phase, and you mobilize more uh, regulatory and purely administrative based regimes that operates in a punitive logic that's pretty much preventive. You know, for those who are wondering how this may affect you or not, well, I think a couple of these things was also implemented in the context of social control during the pandemic, and blocking zone restrictions, entering in private space without necessarily legal guarantees, and so on and so on and so on. And there are multiple of them. So just a case of Mary, and this already almost leads to our conclusion. Well, Mary got old, ancient construction worker on social aid, the regular consumer of cannabis. Well, living in Quebec, there's also this provincial side that was up to then, which was more restrictive than the federal framework. And on top of that, you know, he had to figure out what he can smoke or not in his city or even neighborhood if it's Montreal, and not talking about one particular regulation on municipal level. There's a tons of them just in Quebec, and it's endless in Canada. So when looking to Mayor, like Mayor's okay, like he's a very he needs a certain alignment, a certain synergies between these multiple regimes that's operating in various jurisdictions. And like sometimes, you know, a matter of smoking or not, like he can smoke based on the laws of Canada, but not in the laws of Quebec. Well, but he still can smoke regarding his condo regulations. But well, he's not an owner of his apartment. He has a rental contract, and then, well, he cannot smoke. Same thing if you use the example of the university in Ottawa. We have pretty much the same state-based framework. What's changed regarding smoking on campus or not is local regulations internally at the University of Ottawa and Carleton. In Carleton, you cannot smoke. In Ottawa, you can smoke where you can smoke tobacco. Doesn't work for residents. There's some contracts in place that that do not allow smoking residents. So this is very complicated, and I think like this idea of a particular alignment is quite interesting because, well, this can go quite wrong depending on how harm reduction is framed in any one of these sides. And really concluding, well, this is a process is still going on. What we know so far is that criminalization does not mean this stigmatization, especially for those already in a vulnerable position. Well, the legalization as a possible site of harm reduction was very selective. You know, from the social control point of view, this idea of first do less harm or no harm was in place exactly was already no harm before. So they got the good side of the market in a way. The more problematic, there's still some issues to deal with. This density of norms, they create lots of barriers for harm reduction, but they also create new possibilities of alignments and of synergies that we still don't know. We still have lots of work to do in terms of harm reduction, and especially to understand these possible new alignments. Thank you.
Thank you so much, Dr. Velloso. That was a wonderful little talk. Again, so we're not going to open for questions at the moment, and I'd like to move directly into our second speaker, Dr. Hardcastle, Professor of Law at the University of Calgary. Take it away. Thanks so much.
There we go. Okay. Sorry, it kept defaulting to the wrong presentation. So I wanted to talk today, really following on the previous speaker's talk. What I'm going to say follows quite well on that, about the regulation of cannabis and how it builds in some of the principles of harm reduction, and how we can also evaluate the successes or lack of success of our existing cannabis laws, and make reforms on those laws based on harm reduction principles. So if we start, I've identified a couple of different harm reduction goals. I could have picked other ones, but the way that I focus this is that I think when I'm thinking of harm reduction in this context it's not laws that are designed to stop the use of cannabis or even necessarily reduce it, apart from perhaps very intense use that can have health consequences. But when I'm speaking of harm reduction in this context, it's about making it safer. And so there are a couple of different ways that existing regulations try to build that in. One example would be, one harm reduction goal would be to have people reducing the use of combustion as the way of consuming cannabis. And, you know, interestingly, the legislation in this regard didn't really have that as its focus. Initially, products like edible cannabis, topicals, certain kinds of extracts were all pushed off for a year in terms of their availability. And so in that way, the existing regulations did not have, or the initial regulations did not have as their goal that particular means of harm reduction. Another way that the regulations may get at this idea of harm reduction is through controlling the potency, so the THC content, controlling safety through packaging, making it unappealing to children, for example, and then quality control. So issues of molds and pesticides and other contaminants to human health. And so certainly the government's initial set of regulations did have some of those goals within their sights. The early regulations regulated the producers and so touched on those quality control issues. There were packaging and labeling rules. And so I think the regulations certainly had that type of harm reduction in mind. A third way of looking at harm reduction within these regulations is having regulations that are designed to reduce or prevent higher risk forms of cannabis use. So this could be things like intense and frequent use, binge use, combining cannabis use with the use of other substances, or use when driving cars. Certainly some of those things were not on the government's radar in their early regulations, although they may have addressed them through education campaigns. So things like responsible use guidelines or statements about mixing cannabis and alcohol. In terms of the regulations, though, they did certainly target the issue of cannabis and driving. We saw changes in both provincial laws and federal laws to attempt to achieve that harm reduction goal of that particularly dangerous use of cannabis. The final, I love this kid with the cannabis plants. I include him in as many presentations as possible, so here he is. And so the final harm reduction goal of legislation may be to promote the consideration of specific vulnerable groups. And so this may be young people, people with medical conditions, other medical conditions, racialized groups, maybe on the basis of socioeconomic status. And so certainly the initial set of regulations from the federal government and indeed even the provinces and the municipalities put a great deal of emphasis on protecting children in particular. There was less focus on some of those other vulnerable groups, but certainly the initial regulation had as one of its main goals to prevent use by young people. And so in the federal legislation, we see rules around advertising directed to children, offenses for selling to children, and then at the provincial and the municipal level, we see things like restrictions around consuming near schools or near other kinds of recreational facilities where young people would frequent. So that was certainly a focus. And so I'll come back to these four harm reduction goals momentarily. But first I wanted to dig into actually the youth issue a little more to show how when we're talking about harm reduction in this context, I think it's important to not just talk about health-related harm, like the physical harms that result from impaired driving crash, or the physical harms that might result from many years of intense consuming of combustible cannabis, or some of the concerns with pesticides. So those are all health related, but I think part of harm reduction here also has been and should continue to be other kinds of societal and political factors that can affect the individuals. So to dig in more on that, on the young people issue, one of the issues that I think is really exemplifies this was the age at which the provinces set for young people to be able to purchase, possess, etc., cannabis. And so the federal floor was set at 18. Most of the provinces raised that to 19 to correspond with their drinking laws. Alberta is the only one that's still 18. Quebec was initially 18, but then their government raised that to 21. And so interestingly, there was a lot of discussion around this time at what the appropriate age should be. The Canadian Medical Association came out quite forcefully recommending 21 on the basis of young people's brains continuing to develop into their 20s, and certainly some medical evidence around of mixed quality around the risks at consumption by young people. The problem is in making that recommendation, which focused really on health issues, it neglected to consider some of the other factors at play. And so this includes, for example, the fact that even prior to legalization, so this table here is prior to legalization, and even prior to legalization, there was significant consumption by individuals in that age group that could be left out if we set the age at 21 or even 25, as some people argued. And so, because there's evidence that group wouldn't necessarily be deterred or reduce their use based on the age being 19 versus 21 versus 25, the concern is that by leaving that conduct criminalized for those people in their late teens, early 20s, that while we may be theoretically protecting their brain health based on some of that literature, again, of mixed quality, the concern is that we would be instead exposing those individuals to purchasing on the black market and the other kinds of products available on the black market, other kinds of drugs, and we might be exposing them to criminal records. And so I think that the government actually here did a good job in balancing some of those maybe medical concerns with some of those other health and social and legal considerations. And so in that way really achieved, I think in some ways, that goal of harm reduction. So if we go back to kind of try and measure up Canada's laws on those four dimensions of harm reduction that I started with, and I could have picked any number of data points to illustrate this or to critique these laws. So I've in some ways the ones I've picked are arbitrary. But as I mentioned, one of the goals is to shift people away from the combustible forms of cannabis to other forms. That's one mechanism of harm reduction. As you can see, though, a significant percentage of people are still primarily consuming cannabis through smoking it. And I think in some ways this was a regulatory failure resulting from the fact that the government pushed off the availability of edibles. Even once edibles and other products were legalized, Health Canada took additional time to approve those. I mean, there was a lot of criticism around the variety of products available, the potency, and so in some ways you can't put the toothpaste back in the tube on undoing how those regulations were initially rolled out. But certainly this is something that policymakers need to have in mind as they go forward and review their regulations on the forms of cannabis other than the smoked forms. If we look at the next the next piece, which was around the quality, the safety, the data point that I've chosen to illustrate that is whether people are buying legally or illegally. And so as you can see from this, most people are still buying most people are now buying legally, but a significant portion of people is still buying illegally, with the health risk of those illegal purchases being potential risks with the quality, exposure to other forms of drugs that may have more significant safety concerns than cannabis. And this is largely a result of price. So you can see that in the factors that influence people's purchasing, quality and safety, most people list as among the most important factors, but price is huge too. And so while we've seen the prices within Ontario's cannabis stores go down, the black market prices have commensurately gone down as well. And so now according to Statistics Canada, the average price of legal cannabis is just over $10 a gram, whereas the price of illegal cannabis is $5.73 a gram. So huge discrepancy there. I see I have 1 minute, so I'm going to move this real quick here. Another issue where policymakers, and so the price is something that policymakers need to get at if they want to shift more of those people over to the legal market. Another area where I think we can see that potentially there's a concern with what the government has done is that since legalization, we can see that among drivers they took blood from after a crash, the percentage that they're finding with THC in their system and with impairing levels of THC in their system is significantly greater post-legalization. And so that's certainly an issue that policymakers need to revisit from a harm reduction perspective, but also there are concerns with the science around those blood levels. So they need to continue to address that concern as well, about whether or not they've set the impairment levels where people truly are impaired. And there are concerns with the testing technology there, which we can come back to in the questions. The final bubble that I wanted to hit on, and I'll just pick one of these things, is the pardon issue. And so if we're talking about harm reduction and the societal impacts of cannabis, one of the problems that came up early on was the pardon issue. And so Canada has only issued 257 pardons. Having a criminal record, of course, affects employment and volunteer opportunities and potentially tenancy opportunities. And so this is an area where I think the government has also needs to make improvements with respect to harm reduction. The initial process was over $600 to get a pardon. It was onerous, and so many people didn't apply, even when the government loosened those restrictions. And so now, one potential thing that people are calling for is for the government to just clear those records without people applying. So that would be a potential harm reduction strategy there. So I'm out of time, so I will just leave it at that. And I'm happy to come back to the medical piece that I skipped over in the questions.
Thank you so much, Dr. Hardcastle, for that wonderful talk. We're definitely 2 for 2 on wonderful talks so far, and I'm sure that the next 2 panelists will follow up as well. So our third speaker today is Stephanie Lake. She is a doctoral student in the School of Population and Public Health at the University of British Columbia, and also a graduate student researcher with the BC Centre on Substance Use. Take it away, Stephanie.
Hi, everybody. Sorry, my connection is a bit unstable, so hopefully you'll be able to stay connected with me throughout my presentation. So I'm going to pivot a little bit from talking about the harm reduction aspects of the cannabis law to talking about cannabis as harm reduction based on some of my doctoral research based in Vancouver. I use epidemiological methods to look at the uses of cannabis and the applications of cannabis, particularly in the context of pain and opioid use disorder. So before I start, I do want to acknowledge that my work does take place on the unceded traditional and ancestral territories of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh nations. So as everyone here is quite well aware, in the province of British Columbia, the overdose death rate accelerated quickly with the emergence of highly potent synthetic opioids such as fentanyl in about 2015. This culminated in the declaration of a province-wide public health emergency in 2016, which led to the subsequent scaling up of several evidence-based public health interventions to address the crisis. However, the overdose death rate continues to reach historic high levels, leading to calls for additional innovative strategies to contribute to the multifaceted approach to tackling this complex public health challenge. So calls to explore cannabis-based policy interventions to reduce opioid use and opioid overdoses really occurred kind of in preparation for the legalization of cannabis in Canada, and also on the heels of a study that received widespread attention for its findings. The study, which was published by Marcus Backhuber and colleagues in 2014, compared changes in opioid-related overdose deaths between US states that did and did not legalize cannabis over a 10-year period. And the authors observed a significant reduction in opioid-related deaths following medical cannabis legalization in states that legalized medical cannabis, compared to states that did not legalize medical cannabis over that same time period. And so a major limitation, however, of this study is that it really can only look at rates at the state level. So the authors can only hypothesize what might really be happening at the individual level. And so one potential explanation is that people are using legal cannabis to manage certain things that they may have used opioids for before, such as pain, leading to a reduction in the use of opioids and potentially a reduction in the use of opioid-related harm. But of course, in order to understand what's really going on at the individual level, we have to look at patient-level studies. Unfortunately, the majority of research documenting patient-level behavior tends to be restricted to patients who are recruited from the medical cannabis kind of dispensary patient population. And so what this means is that we don't have a control group of people with pain who aren't using cannabis. So we can't really tell what's going on in comparison to someone who's not using cannabis. But what these studies do show us is that people who use cannabis report substantial reductions in their use of opioids following the use of cannabis to manage pain. But while pain patients represent an important group of individuals who may be more susceptible to opioid-related harm, there is a clear need to understand this possible opioid substitution or opioid sparing effect among people who use drugs who are really at the highest risk of overdose. Qualitative research has provided a window into the possible role of cannabis as a tool for harm reduction among people who use illicit drugs. In particular, narratives from this research describe the use of cannabis to transition away from high-frequency injection of drugs, or to manage some of the negative symptoms associated with withdrawal from substance dependence. However, there is very limited quantitative research that confirms whether these individual narratives translate into measurable effects that can be seen within the community. And so this is really where my research comes into play. And so I'm going to just touch on kind of 1.5 of my thesis chapters in this presentation. So this chapter, or this study, really looks at the use of cannabis and among people who use drugs who are living with pain. So previous research shows that pain is high among people who use drugs, but that they experience many barriers to receiving adequate pain management. So this chapter really aimed to further understand whether cannabis use is linked with opioid use among people who use drugs with pain. The original data for this chapter came from 2 ongoing prospective cohort studies of people who use drugs in Vancouver. Vitus follows HIV negative people who inject drugs, and Access follows HIV positive people who use illicit drugs. Both of the studies have been ongoing since 2005. And the way they work is that participants are recruited and they come into our study office, they're interviewed, and then they come back every 6 months for a follow-up interview. And so these interviews are quite extensive. They sit down with a trained interviewer who captures a lot of information on everything from their recent substance use exposures to their kind of states of health, their housing, their incarceration, harm reduction practices, treatment. And so we can really follow trends in health over time. So for this particular study on pain, I restricted my sample to participants who reported major or persistent pain in the previous 6 months, starting at in June 2014 when we added questions around pain to our questionnaire. I used a statistical model to examine the relationship between frequency of cannabis use and the outcome of daily illicit opioid use in the last 6 months. I also conducted a sub-analysis to further explore potential differences between people who are using cannabis very frequently and people who are using cannabis less frequently to try and understand the reasons behind their cannabis use. So in my main analysis, I observed that the odds of daily illicit opioid use were about 50% lower among people who were using cannabis daily relative to people who were using cannabis, who weren't using cannabis at all. And this was a statistically significant association, even after controlling for a number of factors that were hypothesized to influence that relationship. However, I found that the odds of daily illicit opioid use were not significantly reduced among people who were using cannabis occasionally, which to me signaled an important difference between daily and occasional cannabis users among this cohort of people who use drugs who are living with pain. So in the cross-sectional sub-analysis of 414 recent cannabis users who are living with pain, I looked at differences, reported differences in their reasons for cannabis use. And what I found, you can see here, the blue represents people who are using cannabis daily. They were more likely to use cannabis for pain relief, as well as a number of additional therapeutic uses. So I wanted to highlight a few findings from another chapter of my thesis, as I think they help to contextualize cannabis use for pain in this population. In this chapter, I use something called a latent class analysis to sort participants into discrete groups based on their reported therapeutic and non-therapeutic reasons for use. The analysis found 4 discrete groups that emerged from the data, 2 of which were characterized by pain as the driving motivation for cannabis use. So I'm really only going to focus on those groups for this presentation. So the first pain class was characterized primarily by using cannabis primarily to manage pain. There was a little bit of additional use of cannabis for non-medical and certain therapeutic uses, including nausea, stress, and insomnia, but the rates were relatively low. Factors that correlated with membership in this group included being female, injecting heroin infrequently or not at all, using cannabis daily or more, having been diagnosed with mental illness, reporting that they had not recently experienced an overdose, and reporting moderate to severe levels of pain. We also asked participants where they tended to obtain their cannabis, and members of this group tended to get their cannabis from a retail dispensary or a nonprofit compassion club within the community. The second, so there was kind of a second pain class. I'm calling this the pain plus class because this group is characterized by the use of cannabis primarily for pain. As you can see, everyone's using it for pain, but they're also using it for at least one additional therapeutic purpose. Almost everyone's using for insomnia, but there's a lot of use for stress and nausea as well. But as you can see, there's also a lot of use for non-medical purposes, such as intoxication, which really demonstrates a high level of overlap between therapeutic and non-therapeutic applications of cannabis in this population. And this is consistent with what we see from data from the general population as well. Factors that correlated with membership in this class were using alcohol infrequently or not at all, using cocaine daily or more, using cannabis daily or more, and reporting moderate to severe anxiety levels. Similar to that last pain group, members of this class tended to get their cannabis from a dispensary within the community as well. And I should mention this study period mostly took place pre-legalization. So dispensaries here are not legal cannabis retailers under the Cannabis Act. They are kind of that gray market, potentially city regulated stores, but they may just be completely kind of illegal stores. So taken together, my findings signal that cannabis is often used as part of a strategy to manage unmet healthcare needs among marginalized people who use drugs. I uncovered some evidence to suggest that cannabis use may offer benefit in the context of pain, which lays a foundation for future rigorous clinical follow-up research in this area. Findings from this research have been used as evidence to inform the Vancouver City Council's unanimous decision to allow legal cannabis retail stores in the downtown east side. However, despite that, marginalized people who use drugs may benefit from access to cannabis, especially in the current climate. Cost-prohibitive access to high quality and legal cannabis products is still a major concern for this population. These barriers to engaging in the legal cannabis market will likely force an already marginalized population to access illicit options, which would further contribute to their criminalization. Over the past few years, a number of different community-run cannabis-based harm reduction initiatives have opened up across the downtown east side and in other communities in British Columbia. However, many of them have come up against barriers ranging from police intimidation to eviction. So these community-run initiatives that provide cannabis to marginalized people who use drugs at low or no cost will need substantial support from various parties in order to ensure stability in program delivery and product quality. I do want to note that there are some limitations associated with my research, some big ones to mention here. First, the sample is not randomly recruited, so we have no way of knowing if it's a representative sample of all people who use drugs in Vancouver. We also know that Vancouver has a very unique drug use setting, and so generalizing my findings to other communities may not necessarily be warranted. I did rely on self-reported measures for things like pain and substance use patterns. So of course, this might be subject to some issues of recall and response bias. My data is observational, and so I am hesitant to draw any kind of causal interpretation or causal conclusions about my findings. They are correlational. And finally, my measures of cannabis use had to be quite broad in this population. And so I'm really looking forward to being able to incorporate some more detailed follow-up measures of cannabis use, especially as we move into the era of legalization and consumers may have a better sense of what they are actually using. So to conclude, overall my findings presented here and covered in much greater detail in my dissertation really suggest that cannabis can be viewed as one piece of a much larger, multifaceted response to the mounting crisis of drug-related harm, but it's definitely not a standalone solution. Cannabis-based interventions for people who use drugs are really unlikely to yield much benefit unless they are easily accessible to the most marginalized people in the community and integrated within broader social and structural supports such as stable housing, evidence-based treatment, and well-established harm reduction programs. Thanks.
Thank you so much, Stephanie, for providing us an update on all the great work that's happening out in British Columbia and Vancouver. So for our final speaker, before opening up for a Q&A session, I'd like to introduce Ryan Pusiak. He's a PhD candidate in the Department of Biology at the University of Ottawa.
Hey, Corey, thanks for the intro. Wow, so many great talks so far. This is amazing. Just going to share the screen and off we go. So I titled my talk Through a Harm Reduction Lens, Quality Control, Quality Assurance of Cannabis in Canada. I'm kind of in the throes of writing a paper on this with a member of the Harm Reduction Hub, Chelsea Cox, as well as my supervisor, Corey. So a quick background, I'm a PhD student studying the anti-inflammatories of properties of cannabis and hops, but I have some skepticism knowing the potential harms of cannabis along with potential benefits and less harms of hops, which is put in beer to make it bitter. So previous work, I've done some stuff in psychology. Courses included substance misuse, and kind of overarching life goals is just to try to reduce the suffering of people and the world, and harm reduction tends to attempt to reduce this suffering. So a little bit about cannabis legalization. The rationale in Canada was to reduce the proceeds of crime, reduce access to youth, and protect the public from potentially contaminated drugs. So the three main groups I'm interested in for this presentation is government policy, licensed producers, and last, the consumers. So how is the sale of legal cannabis structured? Well, licensed producers complete a form and get approval from the government. Let's assume that they get approval. then the LP can start producing cannabis products, but might not be able to sell directly to the consumers. Testing must be completed prior to sale. So this is part of the quality control side of things, is microbial, pesticide, and THC potency. Then the LP tends to contact sellers and distributors who then sell their products, usually crown corporations throughout the province. Consumers should likely purchase cannabis from licensed sellers who sell it to, or who buy from licensed producers. So it's kind of confusing because there are upwards of 8 different licenses you can apply for cannabis. So, but the Government of Canada website is pretty clear about the differences among the different licenses. So as mentioned in Lorraine's presentation, it's a 2-stage approach through the Cannabis Act and cannabis regulations. So in October 2018, that allowed for the sale of flower, oil, and tinctures. There was no limit on the potency of flower, though there were limits put in place for the potency of oils and tinctures. Cannabis itself really can't go beyond 30% THC, so that's kind of the cap. There are limits on who can sell and how cannabis could be sold, so that was all done initially online. Then a year later, it was the sale of concentrates, topicals, and edibles. There was generally a limit of 10 milligrams per dose on edible products. So yeah, there were some strengths with the government policy, so slow release of legalization, so to adjust legislation after the first stage, tease apart the effects of different categories of cannabis. It also included warning labels and plain packaging, which is pretty important for the consumer. And with this, it's more of a top-down approach, so government-controlled usually indicates safer products. It's also less harmful than the free market, as seen in either decriminalized areas such as the Netherlands or Washington State, Colorado, you name it, that had higher risk of contamination, inconsistency within the same product, and an issue with potency of edibles. So it can be seen in Vandre et al. 2015. However, there are some weaknesses with the government policy. There's the sale of edibles that was illegal in 2018, but can someone make them and then eat them? Because they generally don't want to smoke, because there's been so much push to stop smoking. So that was kind of a juxtaposition. In 2018, there was an increased sale of illicit products online that did not have the government oversight or approval. So it's hard to almost differentiate between the legal online and the illegal online, because both of the websites are pretty captivating. They did not account also for the price drop and ubiquity of illicit cannabis. They made less in taxes than anticipated. They also set no variability limits on THC and flower cannabis. So I'll chat about this later. In contrast with alcohol, there's like clear QA/QC protocols. And if it goes outside of that range, then the alcohol isn't sold. Whereas with flower cannabis, you could get one that's 5%, but it could actually be 20% THC. And that's could be harmful for users that are assuming that they're smoking or vaping or consuming 5% THC cannabis. So a couple of things from the licensed producers: extensive product testing. So that included fertilizer, pesticide residue, heavy metals, microbes, THC, and CBD levels. So this generally reduces the risk of contaminated cannabis. In contrast, yes, there's high levels of variability in certain products, as well as the presence of contaminants that could also occur because they're not going through validated testing for these contaminants. Also, there's proper documentation for cultivation and harvest, such as packaged on dates, practicing recall scenarios, and keeping full recalls on the record for 25 years. Some weaknesses though, undercut by illicit sellers, reduced prices. There's kind of a lack of advertising, so that was a strength of the government, but it's kind of a weakness for licensed producers. And the initial expense, it's quite high. So that's preventing certain individuals from becoming an LP, especially maybe those marginalized groups that have been talked about before. Also, in-house testing is pretty expensive in terms and cost. Another interesting thing that makes, I guess, this presentation unique is that I'm mentioning that there's no validated method for quantifying THC, and there could be variability between testing facilities. So that's pretty interesting. That means that if a cannabis sample is 10% THC, then one LP could test it and it could be 5%, and another LP could test it and it could be 15%. But the actual percent is 10, so it's hard to know. Also, some LPs own third-party testing facilities, which kind of defeats the purpose of calling it a third-party testing facility. It might be biased. Based on these reasons, some cannabis strains can vary very widely in the level of THC, from 14 to 27% as seen here. It's very potent, but the user ultimately does not know which cannabis they're buying. Are they buying the one that's 14%, or are they buying the one that's 27%? It's pretty scary when it comes to that, because imagine if it was wine that you're drinking is it 12% or is it 25%? You don't know. So going on to the consumers, finally we have a government verified product, which is great. There's a lower risk of contaminants, more accurate dosing based on the THC levels on the package, which are more strict for the edibles and topicals. The choice, so there's a wider range of products, strains, and producers. Online, there's a certain degree of anonymity or being anonymous. So that's good for certain professionals that don't want to be seen in storefronts, but the storefronts, you get a sensorial benefit with the view and smell of different products. So that's pretty good. Non-QA QC would be less stigmatization of cannabis use. As it's legalized, more people are kind of starting to realize, okay, it's maybe not all that bad. Although there are some weaknesses, there's some issues with microbial contamination. So this is from Health Canada recall of a specific type of cannabis that had mold, which can be found because you're dealing with a moist substance, and that could result in mold. There's a potential for inaccurate measurements. So here there's just, they completely mess that one up. So they have the correct values listed there. The THC on the label was 0, but it's actually 20, and the CBD was 0, and it's still 0. So it's kind of interesting. There's a purchase limit of 30 grams. Somebody might want to have more. Dosing of edibles, limit of 10 milligrams. Flower can have 200 milligrams per gram. So then does the user know, do they have to consume 200 milligrams to get the same effect? Illicit online retailers, again, they had the sale of creams, edibles, concentrates way above the proposed limits. So here's an example of a chocolate bar that you could buy online for $35, and it has 525 milligrams of THC. Remember that Health Canada capped it off at 10 milligrams of THC. So that's pretty concerning. Bulk wholesale prices tend to go beyond the government limits. The point system for loyalty is also kind of an incentive, and captivating and fun packaging on the illicit side than on the legal side that has to be plain. So here are some take-home messages. We've got Canada finally legalized cannabis, and it's been in place for 2 years now. It's pretty good. Government balanced health policy with investors' interest. LPs could conduct product testing to prove that their product is safe for consumption by people. And consumers can now choose from a variety of products, although alternative avenues still exist. And hopefully with these policies in place, we can reduce suffering, though there's still more work to be done. So some acknowledgements: Dr. Corey Harris is my thesis supervisor. The Harris Lab, Chelsea Cox, excellent co-author and collaborator. Harm Reduction Hub of Ottawa for putting on this conference, and support from family and friends, especially my fiance, Amanda. And note, all the pictures except for the crazy chocolate bar and the can of beer come from the OCS website. So there you go. If you have any questions, I guess we'll take them shortly. And you can always email me too. So thank you very much, everyone.
Thank you very much, Ryan. And thank you to all of our speakers and who will now be panelists. We have about 15 minutes of time for questions and answers before there's a lunch break. I'm sure that everyone is itching to use the facilities and get something to eat, but I think that we should, I encourage everyone to take the opportunity to ask questions and contribute to the discussion while we have these great panelists available. So there were a few questions that were submitted on the open Q&A platform, most of which were answered internally. So feel free to send in more questions. There is one question that has come up, and this is for Stephanie Lake, and so I'll just read directly. There's literature in health geography surrounding the concept of therapeutic landscapes. You mentioned qualitative components. Could this be one way to discuss the therapeutic use of cannabis? And I think Vancouver does provide a very unique environment, as you mentioned.
Yeah, thank you so much for the question. I'm actually not familiar with this term, therapeutic landscape, so I'll have to do a little bit more reading into it. But I do think that as we kind of ask more about reasons for cannabis use in Vancouver, we are really seeing that there's this wide spectrum of use, and therapeutic uses really take up a substantial amount of the spectrum in the population. So I would be really interested in learning a little bit more about this research. The qualitative aspect that I presented in the background. So I'm a quantitative researcher, and I love reading qualitative research because it really gives so much context and nuance to the findings that I tend to find in my research. So I'm very excited to go read a little bit more about that. So thank you very much for bringing it up.
So while I invite others to ask questions, there was one issue that I would really perhaps address to Dr. Hardcastle and or Dr. Velloso, and it's with regard to pediatric access to cannabis, particularly in the medical context. Many of us may have heard that CBD is considered a bit of a miracle drug, and I have 3 kids, and I can attest to the fact that everybody's using CBD for everything. And under the current regulations, giving CBD to a child that is illegal. Accessing cannabis and giving it to your child, and this creates barriers or even discussion between parents and doctors for fear of stigmatization or even criminalization. So any thoughts on where we might be going in terms of cannabis-derived products that children are actively using?
One initial thought, and this was something I actually meant to say, which is perfect because I didn't get to it, was the issue of should we have separate medical cannabis regimes and recreational cannabis regimes? And one of the things that actually the Canadian Medical Association recommended was people can buy it recreationally, so we don't want to have medical regulations at all. Just buy it, recreationally and self-medicate if you wish. The nurses came out, you know, complete opposite to that and said, no, we don't want people not talking to their doctors if they're using cannabis to medicate for certain conditions. And so the federal government said it would come back to that question within 5 years. And I think that this general kind of concern with people not talking to their doctors about use if they're not using through medical channels, or, you know, using it on children. I think that if we get rid of those medical recommendations and just make it a purely recreational product, that those questions won't be answered. Because if we have the medical profession withdrawing itself from issues of cannabis and appropriateness of cannabis use, I think there's huge concerns. And so I think it's important that one of the policy recommendations that I would have is, when the government comes back and reviews that question, when they do, that they should keep those medical, even though a lot of people are purchasing recreationally to use medically, I think getting rid of those regulations almost gives the medical profession a pass to become uninvolved in this space. I don't know if I'm sure others have thoughts on that question. I saw some of you nodding, so.
Yeah, I could probably give a little piece here where certain individuals might need a higher dose than what is currently legally available for things such as edibles or topicals or any of those types of products. So with that, perhaps there can be a prescription that can be filled out by a doctor that can say, hey, this individual needs this amount of THC in a given product, and they take it twice daily, right? So it's almost more of a prescription, taking it medically, than it is kind of saying, oh, I'm just going to eat a gummy bear like when I wake up, and then I'll eat 5 more because I need 50 milligrams of THC, you know? And then maybe there are health consequences with that, right? If you're just plowing back edibles all day. So, yeah.
No, and as others put, like, it's quite interesting because, like, you know, there's no over-the-counter medicine in this issue. Like, you cannot like have a gummy bear and then, you know, give to your kid, because this would be a criminal infraction, actually, even if you had legal access to that. But, you know, on the medical side, well, there's also possibilities. And what I find it's quite interesting and it's an example that's not related to Canada, but it was a similar debate that happened in Brazil the last 2 years, which has a very prohibitionist framework. It is totally illegal, cannabis, but well, you know, cannabis growers and associations of parents with some disease, they did strategic litigations to have access to grow their own cannabis and to produce the oil in this kind of co-op, even if cannabis is illegal in Brazil, but on medical grounds. So it was not even available yet as a medicine in Brazil. There had some decisions that they should import oil from US, and it was very expensive and not necessarily accessible. And, you know, basically they mobilized the health law framework to counteract the criminal law framework in a quite successful way. And we may be entering quite soon in a territory that may lead to that, you know, to provide some accessibility to over-the-counter medicine in this sense, I hope.
Thank you for all of your responses. And I mean, I should add that the Cannabis Act is up for its 3-year review, a process that is going to be long and arduous, but certainly for all of us in the harm reduction area, you know, this is an opportunity for us to perhaps work together to convey some of these messages to the government. And so I'll use that as a segue to a question that's come up, and this is directed for Ryan, and it's making, you know, that regulations come in different forms. And in Canada, currently, we're going with public regulations, and the question is that perhaps Canada should consider a mixed private-public model at least in terms of quality assurance and quality control, at least is my interpretation for the question. Feel free to clarify. And so Ryan, do you, are you familiar with the Marijuana Enforcement Division of Colorado's Department of Revenue, which does which does 100,000+ tests routinely on cannabis outside of, as a private sector oversight measure?
Yeah. I've read up on them a little bit. It turns out when it was kind of the early years of recreational cannabis use, this is where there was kind of less laws put in place. But when more safety precautions are put in place, then this public-private model can really work well. Clearly, with all these tests, that generally shows that the cannabis is being vetted as safe, and that's good. So yeah, I definitely think that could work in Canada, mixing both the private and the public sectors when there's so many tests being done, and really everybody gets a piece of the pie. So, or brownie in this case, I don't know.
Self-regulating at the industry level, does come with risks, but I think there's lots of examples of where this has led to a safer supply of products in different sectors as well. So we have about 5 minutes left. I always have questions, but I don't want to hog the opportunity. So I do encourage any of the participants who have been listening quietly, if you have any questions that you'd like to ask, now's the chance. I also, if any of the panelists have some questions they'd like to ask of their co-panelists, feel free to take the opportunity. Okay, so I will maybe just put out a final question and leave it open to all panelists. And this is really, I think it's timely no matter where you are in the world right now. And so obviously equity, diversity, and inclusion is a very important movement for us, not only at universities, but across society, and we see it in the United States. And I think, everyone has spoken about it a little bit in different ways. And so I was wondering, are there specific steps that we can be making to, as a society here in Canada, to reduce the harm to those vulnerable populations that we see across the board, in terms of the changes in regulation that Dr. Velloso was highlighting, and some of the very specific examples that Stephanie was able to provide for us.
I can start. So I think something that Dr. Hardcastle brought up in her presentation that I'm a firm believer in is wide-scale expungement of criminal records for cannabis possession. So right now, as Dr. Hardcastle mentioned, it's the process was quite onerous, and I think now, even though they've removed some of those restrictions to make the process a bit easier, people still aren't applying for pardons, and I don't know why. Maybe it's just that people don't know, or they don't really understand the process. It's not really widely known. So I think taking the onus off of the individual would really help to kind of remove some of those inequities. Sorry, my cats are fighting behind me. And then the other thing I think, which is super relevant to my presentation, is really finding ways to ensure access to cannabis for financially or economically marginalized people. So right now, engaging with the legal market is quite cost prohibitive. And so, of course, that leads people to engage with the illicit market, where they're not getting products that they know anything about the quality. And then also they're being recriminalized, or for something that is now considered basically legal in most senses. So finding ways that we can really increase access to these populations would be super important. So finding kind of loopholes to to providing access. That's something that the City of Vancouver is currently working on so that we can start kind of supporting those low barrier cannabis based harm reduction initiatives. So that would be one other big thing.
Thank you, Stephanie.
I can maybe chime in. Yeah, I think obviously the pardon thing was something that I had hit on, and I think you're right. Just expunging those records, you know, on the initiative of the government would be easier at this point. I think that probably word got around that it was hard to apply, and so people didn't, and then they weren't aware when the government changed it. I know that the government did send out letters to some groups saying they had changed it, but sorry, I don't think word got out about that. I think you're right about the, you know, the getting it out to different people and reducing the cost. And I know, you know, unfortunately, there's been some closure of some programs that did actually try to get cannabis to people, you know, at low cost or for free, as a means of substituting it for other drugs. I think even some of the bylaws, though, can have these differential impacts on different groups. You know, I know in Calgary, for example, there's no public consumption compared to the many other places in Alberta which have public consumption. And it would seem to be sort of an afterthought, like, oh, you know, what about homeless people? And what about people who live in apartment buildings with landlords that are going to prohibit this? And so I think that oftentimes those groups become an afterthought. And so I think in going forward, hopefully with, as you say, Corey, this new focus that we've seen, or this reorientation on equity and diversity concerns, hopefully the government has that at the forefront in designing the laws, as opposed to after the fact saying, oh, where will these people consume? And then there was some discussion of like permits in parks. So instead of it being an afterthought, I would hope that it's built in to the laws in the first place. Just like the $613 or $18 wouldn't have existed for the pardons had they thought about that to begin with.
Okay, thank you so much. I will offer a last word for anyone else on the panel, but I do think that was a great way to end off. Oh, there's more. Oh, there's no, but now it's noon. So I guess for those, if any panelists are willing to stick around for a couple minutes into their lunch period, and if anyone needs to leave, that's completely acceptable, obviously. So there's a comment that we have the example of the prohibition of alcohol, but once prohibition was discontinued, did bootlegged alcohol not get supplanted by legal alcohol sales? How did that happen? Are there lessons to be learned there? I think that might be a bigger question than something that we could tackle in a minute or two, but if anyone has some thoughts about that.
I've been meaning to get into like the research of like the history of alcohol in Canada. But from what I saw, I think it's the decrease in sale and the increase in safety of purchasing like Crown Corporation approved alcohol. And then that essentially resulted in the decrease of bootlegged sales. As well as the prohibition of other drugs. So it's kind of, it may have just been a handoff. That's another alternative.
But there, I mean, there are also some very serious risks to bootlegged alcohol, and the harm reduction benefits of the legal source, and then the very organized distribution that developed, I think, was a big part. And I don't think in cannabis, for example, that it's to the average user that the government has communicated that there is less risk, you know, in a cleaner supply. You know, I think that is a very clear message that was made in alcohol across the years, and we're still in the early stages of that for cannabis.